Hi. Okay, it's Mrs. Sager again, and this skill is skill 6.11, assisting with a bedpan. So the first thing you're going to do is you're going to gather your supplies. What supplies do I need? Well, you're going to need a bedpan. Imagine that, for assisting with a bedpan, right? Okay. Well, some of you have seen a couple of different variations of bedpans. I'm going to show you the two different types, okay? This is a standard bedpan. This is used for assisting a client with, voiding, okay? So it's, if you can see it, this front goes up, okay? It goes up, okay? And this is a more flat area here. This is the part that's going to be inserted underneath the buttocks, the flat area, okay? This is going to go towards more around the urinary area, okay? So this would go under your resident or patient like this. Okay, that's for a regular person, somebody that, you know, of average height and weight and all that, okay? Then we have what is known as a fracture pan, okay? Can you see the difference between these? I mean, one's big and bulky and really, oh my. And then there's this fracture pan, and it's called a fracture pan because this allows us to insert it underneath somebody. So this part, this flat part, would go under the buttocks, okay? And then this area in here would collect the urine or the poop, okay? Fracture pan, if somebody fractured their hip, and wasn't able to lift very much up off the bed, this is the bedpan that you would use for them. It's called a fracture pan for a reason, right? We'd also use this for frail little old ladies that don't have much to them. This regular bedpan can really hurt them with them trying to sit on it and go. So we would use a fracture pan. We'd use a fracture pan for a pediatric patient, okay? Make sure you use the appropriate bedpan that you be required for your resident, okay? For the sake of this skill, I'm going to use the regular bedpan, okay? So you would collect your supplies. What other supplies do you need other than a bedpan? Okay, well, most patients' beds have a disposable absorbent pad on them. You want to bring another one with you in case we're not so good at placing a bedpan and it kind of gets a little wet, or the patient just decides that they're going to dump all of their urine on you and you overflow the bedpan. So we need to replace the pad. Okay, so we got another pad with us. I want you to bring a chuck. A chuck is a disposable pad that can be utilized to put your dirty bedpan on when you've taken it out of out from underneath the patient. Okay, so you can have this sitting on your table, and so you put it on your table. I don't know if you can see this. There we go. If you put this pad on your table like this, and you take your bedpan out, you can set it right on there, and you can actually cover your bedpan. Okay, that cuts down on splashing. It cuts down on visual. I mean, nobody wants to see a pan of poop, right? And then it cuts down on odors as well, and it also gives you a good thing to hold on to bring it to the bathroom in case you've removed your gloves, right? Okay, so you want to bring a chuck with you. You want to bring toilet paper, okay, to wipe. Some facilities have wipes that you can use, flushable wipes or non-flushable wipes. Make sure you know which is which. Okay, most facilities are a non-flushable wipe. So you use a wet wipe on them, and you throw it in the garbage, okay? Some places have perineal wash, okay? You use this to wash the area. You bring a washcloth with you if that's the case, if you have perineal wash. You could also use a washcloth in case you didn't have wipes for later on when you want to allow your resident to wash their hands. Even though they don't touch anything, just the fact that they've gone to the bathroom, they may feel gross. I mean, when I go to the bathroom, I wash my hands, okay? So offer them the chance to wash their hands. Have them feel human and not just a subject that's laying in the bed, okay? Offer them the chance to wash their hands. I don't care if they're dirty or not. Just let them wash them, okay? And it could be as simple as, you know, washing them with a towel, with a washcloth. Or you could hand them a wet wipe and let them wash their hands, okay? And of course, now's the time you really want to use gloves, okay? Ew, urine, poop, I'm dealing with that area. I'm gonna put some gloves on, okay? All right, so you gather your supplies, right? And you perform wipes up, okay? You know what that is? Not getting into it, okay? If you don't know what it is, go back to week 1 and go over what wipes is again, okay? All right, so then we want our client laying supine. Supine means on their spine in bed, right? Okay. So we're going to make sure that there is an absorbent pad underneath them and it's positioned appropriately, which it is here, okay? What you're going to do is you're going to put some gloves on. Because you don't know if that bedpan's clean or not that you're touching, okay? Maybe the person that used it ahead of you didn't wash it very good. Or maybe there's something on the pad already. You don't want to be putting your hand in that. So gloves, people, gloves, okay? You're going to take your bedpan. And then, well, first of all, you're going to have your person, if they're able to help you, put their legs up so that their feet are flat on the bed, okay? Okay? Now you would keep them covered. For here, you need to be able to see what's going on, okay? So I'm going to uncover. Okay, and then what you would do is you'd have them lift their hips up off the bed. If they can lift it a little bit, but you need it a little bit more, you could always lift as well with them underneath their lower back. Flat part goes in first, okay? So flat part in, underneath the buttocks, position, okay? Recover, put the side rail up. At this point, your little old lady's probably saying, I'm done. They do that, okay? If not, put the side rail up, put the head of the bed up, okay? Because when you go pee or poop on the toilet, are you laying down? No, I don't think so, okay? So you want to put their head up to a position that's comfortable for them. You want to lower the bed back down to the lowest height possible for safety reasons, okay? When that's done, you want to give them their call lights, okay? And you want to give them the toilet paper if they're able to wipe themselves, okay? And you explain to them, I will be back, to hit your call bell when you're done, and I will come back to assist you. At this point, you would leave the room. You would wait for them to signal, or if they don't, go back after a little while and check with them, because you want to see if they got ring around the hiney, okay? Literally, they will get a red ring around their behind from the bedpan, from pressure, okay? Pressure means that we can develop a bed sore. We don't want that happening, okay? So after a little while, go back if they haven't rung and see if they're done. Okay, so your patient has signaled and that they are done. Okay, so we're going to go back and we're going to assist them with removing the the bedpan. So what we're going to do is we performed hand hygiene, and we are going to put on a pair of clean gloves, okay? So then what we want to do is we want to bring the bed back up to a nice working height, okay? Because remember, our back is important. We need our back in order to perform our job, to walk, and all that. So we want to take really good care of our backs. So then we put the side rail down, because we don't want to be working over the side rail, right? Okay. All right. So if your patient was able to wipe themselves, what you would do now is that you would get your chucks ready on your stand, okay? You would assist with removing the bedpan. Now, you don't want them lifting up off of the bed until you have a hold of the bedpan. Why do I say this? Because the bedpan may be stuck to their hiney, and when they lift up, the bedpan's going to come up, the suction breaks, and it smashes down on the bed, and now you have a bed change that you need to do, okay? So before they move, tell them, please wait until I get a hold of the bedpan before you lift, okay? And at this point, they would lift, you would remove, you'd put this on the bed stand, okay? You'd put, I gotta move this so you can see, you'd put the bedpan on the bed stand, on the chucks, take the chucks and cover the bedpan, okay? Move that out of the way. You would assure that the pad is dry and that your patient is dry and comfortable. You'd put them in position of comfort and allow them the opportunity to wash their hands, okay? So that's for a patient that is able to assist you with the bedpan. What happens if you have to do, use a bedpan on somebody that's not able to assist you? So what you're going to do is you're going to make sure that there's supine on the bed. You're going to gather your supplies like you normally did, okay? You're going to assist them to roll over, okay? Now remember, I'm doing this with a mannequin here, people, okay? Don't manhandle your patients. So as you can see, can you see their buttocks? Okay, you can see that? See this bedpan? So what you're going to do is you're going to position it so that it's about right where the buttocks are, okay? And you're going to have them come back down onto the bedpan. Position it so that it's on, so they're on it, okay? And again, put the bed up, lower the bed down, put the side rail up, give them their call light, okay? Come back when they have rung, perform hand hygiene, put on clean gloves. At this point, you're going to grab a hold of the bedpan while assisting your client to move over. If they're not able to assist you, then get assistance from somebody else that can help you roll the patient, okay? Grab a hold of the bedpan, okay? Again, put it on the table, on a chuck, cover it with the chuck. Use whatever it is that your facility would like you to use to perform the care, whether it be just toilet tissue, whether it's the perineal spray in a washcloth, or the perineal spray in toilet paper, or wet wipes that you can either put in the toilet or you can put in the garbage, whatever it is that your facility uses, okay? You're going to clean from front to back. Why do we clean from front to back? Because the urinary meatus is cleaner than the anus, okay? So we're going to always clean from the urine to the stool, okay? So you would wipe from the front to the back. Make sure it's nice and clean, assess it, make sure there's no open areas, redness or whatever, okay? Address whatever needs to be addressed, okay? Make sure that the pad is dry. Replace the pad if you need to, okay, make sure it's dry and clean and without wrinkles. You're going to put your patient in the position of comfort for them, okay? You can remove one glove at this point, okay, and be repositioning, okay? Is it proper to do that? It's proper to do hand hygiene before we do all this, but we want to make sure that our patient is safe and comfortable before we go and take care of everything else. So we want to have one hand semi-clean, one hand dirty, because we still have to pick up a dirty bedpan, right? Okay, so you're going to finagle the bed rail. You're going to get the bed rail up to the position it's supposed to be in. You're going to position the patient in comfort. You're going to lower the bed down to the proper height, and you're going to give them their call bell, okay? At this point, you're going to pick up the bedpan in the chucks. See? The bedpan in the chucks. See how I have it covered, right? Okay, and you're going to take it to the toilet area, whether that's in your patient's room or across the hall. I don't know what each facility has, okay? But you're going to take it there and you're going to clean it. Now there's some sinks. They have these sinks that have, it's a big drop sink and it has like a hand nozzle. You would take that off of there and you would be holding it by this part, the flat part. Why the flat part? Because when you rinse, there's a lip in here, okay? You're gonna rinse up into it, and what it's gonna do is it's gonna splash down into the sink and not up on you. Plus, this is beveled so that it pours out into the sink. See, this would go out into the sink, okay? So you're gonna rinse like this, okay? And you're going to get all that urine and stool out of there. And then you would take a paper towel and you would wipe it out. Now, according to your facility, you would clean it the way that they want you to. Each facility is different, so know that protocol, okay? You would return to your resident's room at this point. And you would, if you put anything with stool in the garbage bag, you would remove that garbage bag. Put a clean garbage bag in there, remove those items. You want to try to control the smell in your residents' rooms. I mean, when we're at home, when we go into the bathroom, we spray or we turn the fan on and it's in our bathroom, and we can go back out into the living room and we're good. Well, these residents can't do that, sometimes they do everything right in their bed. That's one place, so they don't want it smelling. So if you're able to, use an air deodorizer. You may not be able to use an air deodorizer on everyone, especially respiratory patients. That air deodorizer may be harmful to their lungs, and they may not tolerate that. So be mindful of that. Just try to get all the smelly items out of the room that you can, right? Okay, so you're going to clean up your area in your patient's room. You're going to put all the dirty linen away. You're going to get rid of the garbage. You're going to clean the bedpan and store it wherever it is supposed to be stored per your facility policy, okay? At this point, you're going to remove all of your gloves. You're going to wash your hands. And then you're going to document. What are you going to document? You're going to document that they had a bowel movement. You're going to document skin integrity in the area. You're going to document how much stool was produced or how much urine, what was the color, whether it was really odorous, because there's certain stools that as you get through your nursing student career here, you're going to learn that stool tells us a lot about a person. I'm not going to go into that right at this moment. So you're going to document color, odor, amount, consistency of the stool, how they tolerated the procedure. You're going to document all this stuff, okay? So that's it. That's assisting with a bedpan.